About the future of social care in England, evidence gathered by the health regulator and seen by the BBC raises serious concerns about the impact of budget cuts on the quality of care for elderly and disabled people. The rate at which care homes are closing is rising, with some providers saying they can no longer make money. Our social affairs correspondent Alison Holt reports.
Up the door.
Betty Smith is in her 80s and needs help to remain in her own home safely. This is a supported flat, which means there are care staff on hand to help her.
It's more happiness somehow, I think, the happiness, and the people that come in and you meet them.
How are you? Knowing that the same well-trained staff will be there each day is important to Betty and many others who need care. The not-for-profit company that runs these flats used to be a major provider of home care to local councils, but it's pulled out of those contracts because it says it simply isn't paid enough to do the job properly.
We wanted to provide care that's with staff that are well trained, well equipped, and providing the right quality of service. Without the right funding, that becomes very, very difficult.
The regulator, the Care Quality Commission, monitors the finances of some of the larger care companies. In an analysis seen by the BBC, it says the handing back of council contracts demonstrates the fragility of the care market. With council budgets squeezed, it asks at what point will this adversely impact on the quality of service. And that's what worries Cheryl Ennis, who used to work as a home carer for another company.
Sometimes the care is rushed and the client is not properly looked after. They're not properly cared for, and it takes away their dignity.
The CQC analysis also says the pace of closures amongst the more than 16,000 care homes in England is increasing, and it highlights the ongoing struggle to find and keep the right staff. In the last year, this home in Oxfordshire has stopped providing nursing care.
The first challenge is the lack of nurses, how difficult they are to recruit, and that's internationally as well as domestically. And also the difference between what the local authorities pay and the real cost of care.
The charity that runs the home was having to fund the roughly £300 a week difference between what the council paid for each person and the actual cost. There's increasing evidence of the serious knock-on effect that the problems faced by adult social care are having elsewhere. So, for instance, since they made the decision to no longer offer nursing care here, it's meant that the NHS has had to provide more district nurses to come in to see residents.
What we do know is that if we continue to reduce funding available for the broad range of public services, that leads to increased demands on the National Health Service, demands that the NHS is not well equipped to meet.
Care is funded differently in each of the UK nations. In a statement, the Care Quality Commission says in England most adult care is good or outstanding. The government says more money is being put into the care of older and disabled people. Alison Holt, BBC News.